When a woman finds out she has fibroids, but it is not causing any symptoms, she is not having infertility problems, she's not having any complications, she's living her normal life without any symptom at all, it is advisable for the woman to leave the fibroids alone. Do not touch it, do not take any treatment for it, do not go for any surgery, just leave it alone, and it's going to shrink on its own after menopause. As long as it is not increasing in size, it is not causing any fertility problems, the woman is still able to conceive, then just leave the fibroids alone. So hello guys, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we'll get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. If you're interested in this topic, keep watching. So what are fibroids? Fibroids are non-cancerous growths usually found around the uterus. They are non-cancerous. This means they cannot cause cancer. They are usually found amongst women of childbearing age. It is mostly seen amongst black women. Most women who have fibroids will live a normal life. They will not need surgery depending on the size and the location of the fibroids, and it won't even affect fertility. They will be able to get pregnant and have their babies without any complications. Now let's talk about the positions of fibroids and how they cause infertility. I know the diagram is not perfect, please pardon me. So this is the uterus, this is the fallopian tube, this is the ovary, this is the cervix, which is the neck of the uterus. This is the cervix, where the baby comes out from and where the menstrual flow also comes out from. And this is the vagina. So we're talking about uterine fibroids, which are found around the uterus. We have 4 different types. We have the pedunculated fibroids, we have the intramural fibroids, we have the subserosal fibroids, and we have the submucosal fibroids. You can see that these 3 other fibroids are found outside the uterus. They are not really inside the uterus where the baby implants on after fertilization. The only one found in the uterus where the baby implants on is the submucosal fibroid. That is this fibroid. It is found inside the uterus. This is the uterine wall. This is the uterine wall. Okay, after fertilization occurs, the fertilized egg moves down into this place and implants in the uterine wall. So a woman who have these other types of fibroids, pedunculated, intramural, and subserosal, won't have issues with reproduction. She can still get pregnant and carry her baby to term. Okay, but a woman who have the submucosal fibroid usually have issues with conception, because the fibroid is found where the fertilized egg is supposed to implant on. This is the bed of the fertilized egg where they will stay and grow till 9 months. Now there are fibroids here. Sometimes some women have one, some can have multiple fibroids in the uterine wall, and this is going to prevent the egg from finding a place to implant, because when it gets into here, the uterine wall is already occupied, so it finds it difficult to implant. This can lead to infertility. Now sometimes when it manages to find a place to implant, probably close to where the fibroid is, the fibroid begins to compete with these zygotes, making growing difficult for the zygotes. This can lead to miscarriage. Sometimes if the zygote manages to keep growing, as it's growing, the fibroid is growing. As it's growing, the fibroid is growing. At a point, the fibroid can become too big or too large and end up suffocating the baby, if I can use that word. And this can lead to intrauterine fetal death. That is, the woman ends up losing the baby. So you see, other types of fibroids have no problem with conception most of the time, but this particular submucosal fibroid is the reason why some women who have fibroids are not able to get pregnant, because the fibroid is found where the fertilized egg is supposed to implant on and begin to develop into a baby. So the fibroid is dragging space with the fertilized egg, if you understand what I mean. This causes infertility, miscarriage, or intrauterine fetal death. So most of the time, women who have these other types of fibroids do not have problem with conception, and if they don't have any symptoms, the fibroid is not growing, is not disturbing them, they will be advised to leave the fibroids alone. Do not touch the fibroids, no surgery, no drugs, just leave it alone, okay? As long as it is not affecting you. When you get to menopause, it will shrink on its own. But if it's submucosal fibroid, it can affect fertility if you're trying to conceive. Causes of fibroids: one is idiopathic, which is unknown. Second one, we have genetic. Sometimes it occurs in families. We have vitamin D deficiency. Some studies show that lack of vitamin D can predispose a woman to fibroids. Then lack of exercise, prolonged exposure of the womb to estrogen. For instance, for a woman who started seeing her period from an early age, let's say from 9 years old, she have a prolonged exposure of her womb to estrogen. Or for a woman who it took a longer time to get pregnant, her womb has been exposed to estrogen at a stretch for a longer period of time, she's at risk of having fibroids. And also, women who took longer time before they got to menopause are predisposed to fibroids as well. Then let's talk about symptoms. Sometimes the woman experiences no symptoms at all. Sometimes she experiences painful periods, heavy period, very heavy that she can soak through her pads or tampons every 1 hour, or very painful that she's unable to carry out her day-to-day activities because of the pain. So severe menstrual period or heavy flow, excessively heavy flow, are all signs of fibroids. Then constipation or frequent mituration, that's frequent urination. If the fibroid is pressing against the bladder, it can lead to frequent urination. If it is pressing against the anus, it can lead to constipation. And we have fullness or pressure in the pelvis if the fibroid is large. Now let's talk about treatment of fibroid. We have the medical treatment and the surgical treatment. Let's talk about the medical treatment. But first of all, there are some types of food that studies have shown that can help with treatment of fibroids. Those are food rich in vitamin D and omega-3 fatty acids. Examples are fatty fish and green leafy vegetables. And for the medical treatment, we have hormonal therapy. Examples of this hormonal therapy is birth control pills, intrauterine device, Depo-Provera shots. They can help reduce the production and release of estrogen. And estrogen is just a hormone that feeds fibroids. It causes these fibroids to grow and increase in size. Some of them can also help shrink fibroids. Then we have vitamin D. Recent studies show that vitamin D can play a vital role with treatment of fibroids. I mean, if you check it, vitamin D deficiency is one of the causes of fibroids. So this can mean that intake of vitamin D, whether the supplements or food rich in vitamin D, can help prevent fibroids and also help with treatment of fibroids. And we have gonadotropins. This can help shrink fibroid, especially before surgery. Then iron supplements can also be given in case of anemia from the heavy bleeding, just to rebuild the blood that has been lost. So let's talk about the surgical treatment of fibroids. One, we have myomectomy, which involves removing the fibroids while preserving the uterus. It is a very good treatment option for women who are trying to conceive because it is a fertility sparing treatment. Then you have the open surgical myomectomy, where an incision is made, the uterus is brought out and the fibroids is taken out. Then you also have the laparoscopic myomectomy, where small incisions are made and the fibroids are taken out. Another surgical treatment is uterine artery embolization or fibroid embolization. This is cutting off the blood supply from the arteries that supply the fibroids. Some particles are injected into these arteries, cutting off the blood supply from them to the fibroids. When the blood supply is cut off, the fibroids will shrink. Another surgical treatment option is laparoscopic ultrasound guided radiation frequency procedure. This is a type of procedure that uses radiation to shrink fibroids. The last surgical treatment option on my list is hysterectomy. This is the removal of the entire womb, the complete removal of the uterus. But if you go through with this type of procedure, you won't ever be able to get pregnant again. So with this, we've come to the end of today's video. If you enjoyed watching, please do well to give this video a huge thumbs up, subscribe to my channel, leave a comment in the comment section if you have any questions, and I'll be there to respond. Turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned and see you in my next one. Bye.